Hello dear students, very warm welcome to all of you at our conceptual brainstorming integrated session of ophthalmology. So right now in this topic we are going to talk about our vernal keratoconjunctivitis. Yes, already we had seen the different kind of the conjunctivitis. We entered within the allergic conjunctivitis. Within this allergic conjunctivitis, one very important question for all of you, that is our vernal keratoconjunctivitis. It is not only asked in our theory exams, but it is very important for our NEET exams, our next pattern, our INICET, FMGE exams, USMLE, PLAB, every kind of the exams. So in this image you can see there is a one gelatinous ring is formed in limbal area at junction of the cornea and the conjunctiva. At this junction you can see one gelatinous membrane is formed. Usually it is seen in boys, and remember it is seasonal. गर्मी के मौसम में ये प्रेसिपिटेट होते हैं, पॉलन ग्रेन के कारण एलर्जी होती है और आंखों में ये चीजें आपको नजर आती हैं. If you are looking this kind of the situation, then it is our vernal keratoconjunctivitis. Okay, so let's start this very important topic. Fine. So we are going to talk about this our vernal keratoconjunctivitis. One trick also, one very beautiful mnemonic you can get. See here, another name of this disease is, इसका दूसरा नाम क्या है? स्प्रिंग कटार. ऐसा सोचा जाता था कि ये स्प्रिंग सीजन में ज्यादा होता है, लेकिन एक्चुअली ऐसा नहीं है, ये समर सीजन में देखा जाता है. दैट्स व्हाई यू कैन रिमेंबर, पहली चीज ये झूठा नाम है, दिस इज द मिसनॉमर. यस, लेकिन एस से ये शुरू होता है तो आप याद रख सकते हैं एस. यस, 5 to 15 years boys, it is more commonly seen. Next you can see the P for you can remember pseudo gerontoxon. We will see what is this. एस से एक और चीज शील्ड अल्सर हमें पढ़ना है. ओके, देन आई विल रिकॉल द टाइप 1 हाइपर सेंसिटिविटी रिएक्शन. ओके, एन वर्ड विल रिकॉल द लियोन साइन. दिस इज द मैक्सवेल लियोन साइन. ओके, ऑल्सो दिस पी, जब ये पी को उल्टा करेंगे तो डी याद आता है, सो वी हैव टू लुक द डेनी मॉर्गन लाइन इन दिस टॉपिक. आप इसमें सी पढ़ते हैं, सी से कूल कंप्रेसेस. यस, दिस इज one disease which appears in the summer season, इसलिए आइस इसमें हम लगाते हैं, कोल्ड कंप्रेशन हम इसमें करते हैं. गेटिंग द पॉइंट बेटा. नेक्स्ट सी से आप याद रख सकते हैं कोबल स्टोन पैपिला. वेरी इंपॉर्टेंट. कोबल स्टोन अपीयरेंस आपको देखने के लिए मिलेगा. फूल गोभी की तरह बड़े मास हमारे पाल्पेब्रल कंजक्टिवा में नजर आते हैं. गेटिंग द पॉइंट. आगे समझो बेटा. यस, टी से आप याद रख सकते हैं ट्रीटमेंट, टॉपिकल ट्रीटमेंट इज गिवन. Okay, so for the topical treatment we will see one entire portion for the treatment. इसमें हम एंटीहिस्टामिनिक, मास्ट सेल स्टेबलाइजर, स्टेरॉइड देते हैं. Why? क्योंकि ये है एलर्जी, और एलर्जी को सप्रेस करने के लिए we are giving the steroid, मास्ट सेल स्टेबलाइजर, एंटीहिस्टामिनिक्स. We will correlate with our pharma and the medicine. A से आप याद रख सकते हैं there is a acute exacerbation, then you will give the steroid only, otherwise we have to prevent this steroid. Then H for Horner Trantas dots, Horner Trantas spot. So we will see this all the things. So one by one we are going to look this vernal keratoconjunctivitis patient. Okay, so first of all you have to give the definition. आराम से धीरे धीरे हर एस्पेक्ट को तैयार करते हुए चलते हैं. Yes, first we are looking for the definition. How can we define? Yes, try to understand. This is our recurrent. बार होता है, एक बार से नहीं होता. Again and again this disease is getting precipitated. Yes, it is bilateral. ऐसा नहीं कि सिर्फ एक आंख में होगा, राइट और लेफ्ट दोनों आंखों में दिखाई देगा. And you have to remember there is the interstitial connective tissue is also involved. Okay, yes. So all this point you can remember as the RBI. Yes, you know, Reserve Bank of India. So just one funny way to remember this all the points. RBI. Don't forget this RBI. Okay. So we are using our Reserve Bank of India, so that you can recall this very important points easily. Yes, so don't forget this. रिजर्व बैंक ऑफ इंडिया. ओके, यस, फिर से बेटा एक बार मेरे साथ. यस, यू हैव टू रिमेंबर द वर्नर केराटोकंजक्टिवाइटिस. हाउ कैन यू रिकॉल एट टाइम ऑफ एग्जाम? क्योंकि सबसे ज्यादा दिक्कत तो यही होती है, पढ़ लेते हैं लेकिन भूल जाते हैं. यू हैव टू रिमेंबर दिस आरबीआई. व्हाट इज द वर्नर केराटोकंजक्टिवाइटिस? इट इज एलर्जिक डिसऑर्डर of the conjunctiva which is recurrent, which is bilateral, right and left both eyes are involved, and it is involving the interstitium. It is not superficial, it is involving the deep tissue. Okay, now further what you can remember? Yes, it is allergic inflammation of conjunctiva. Yes sir, it is allergic inflammation of the conjunctiva, which is 2 points you have to remember. सेल्फ लिमिटिंग, ऑटोमेटिक ये ठीक हो जाता है, लेकिन जब तक रहेगा तकलीफ तो देगा, इसलिए इलाज करना जरूरी है. यस, इट इज सेल्फ लिमिटिंग. ऑल्सो व्हाट यू हैव टू रिमेंबर, इट ऑकर्स इन स्प्रिंग. दैट्स वाई ऐसा सोचा जाता था कि स्प्रिंग में होता है, स्प्रिंग सीजन में होता है, बट लेटर वी विल सी इट इज मोर कॉमनली सीन इन हॉट, यू कैन से summer season. So remember, actually it is misnomer. ऐसा नहीं है कि स्प्रिंग सीजन में होता है. Later we will see it occurs in the spring season. So you will say that it is showing the seasonal incidence. So these are the our different points. आराम से धीरे धीरे. Yes, it is recurrent bilateral interstitial allergic inflammation of the conjunctiva which is self-limiting and occurs in the spring season. Seasonal incidence it is showing. Got the point? So after this all, we are going to look the our next pattern. Yes, according to the next exam, how this clinical scenario will be given. Okay, see here. Most commonly you will see there is the 4 to 20 year male is coming. This disease is more commonly seen in the males than the female. Now what he will give the complaint? Yes, he will come in summer, more commonly summer, not in the spring, because it was observed that it is seen in the spring season. That's why it is also the spring catarrh, excessive secretion from the eyes. That's why catarrh word was used. Okay, fine. In summer also you can say warm weather. That's why it is also known as the warm weather catarrh. Okay, so remember again I am mentioning spring catarrh is misnomer. Okay, now try to understand further. It is seen more common in tropical countries. Tropical countries where little bit hot weather is there, humidity is there, like India. Okay, नॉट इन द कोल्ड कंट्रीज, जहां ठंड है वहां ये डिसीज नहीं मिलेगी. ओके, नाउ व्हाट यू हैव टू रिमेंबर दिस पॉइंट, नॉट इन कोल्ड कंट्रीज. ओके सर, सो दीज आर द अवर पॉइंट्स फॉर द क्लिनिकल केस. एक ट्रॉपिकल कंट्री में रहने वाला लड़का आपके पास आता है और वो हिस्ट्री देता है क्या? यस, it occurs due to the pollen allergens. Yes, it is related with the allergy. Now you will see also this point, at time of the summer this pollen problems are more, seasonal variation. Again, what the point you can focus here? 2 extra points. Yes, it is related with the pollen allergens. So microbiology integration, it is atopic disease. Yes sir, atopic disease, atopy, type 1 hypersensitivity reaction. And due to this atopy, there is mainly immunoglobulin E hypersensitivity was seen. So hypersensitivity disorder. So remember, this is one proposed theory which is now considered old, which is not considered as true. Okay sir, so these are our different points which you can remember. It is atopic related disease. So this is our microbiology integration. Yes, this is our microbiology conceptual brainstorming integration. Fine. Now try to understand. There is one more thing. There is our Th2 lymphocyte. What you can recall, this disease according to the new theory, इसमें क्या हो रहा है, T helper cell type 2 Th2 lymphocyte, they are showing the alteration. Okay, and this is showing the more immunoglobulin E response, and due to it there is the our allergic activity. This is our new theory. So old theory was saying about the atopic disorder, but now it is saying due to this pollen allergens there is the activation, there is an alteration in the Th2 lymphocytes. Okay, so these are the points which you can remember for the pathophysiology. Now we are going to look for the more points regarding the pathology. So we are going to focus for the pathology. Little more space we are creating for your e-notes. Yes, so here we are going to look the pathology of this disease. So try to understand. You can remember for the pathology one easy way. Yes, that is A, next is B, next is C, then D, then E, and last is F. A, B, C, D, E, F. Now see here, among this all there is the no B and no D. So you have to remember just ACE inhibitor and the F point. Yes, what is the A? A, C, E, F. So A for, we have to know the adenoid layer information, one. C for, we have to know about the conjunctival vessels. Conjunctival vessels. Okay sir. E for, we have to remember for the epithelial hyperplasia. इस डिसीज में इपिथीलियम का बहुत ज्यादा प्रोलिफरेशन आपको देखने के लिए मिलेगा. एंड लास्ट वी हैव टू ऑब्जर्व for the, yes, fibrous tissue hyperplasia. So F for, there is fibrous layer proliferation. So these are the points which we have to focus. So one by one, first we are going to look for the our adenoid layer. Yes, you will see in this situation, due to the inflammation, there is the more and more inflammatory cells infiltration, which will create this our adenoid layer. So in our vernal keratoconjunctivitis, you will see more and more cell proliferation. So what in exam you can mention कौन से inflammatory cells बढ़ेंगे? So you can see there is the more count of the eosinophil, because it is the allergic disorder, और एलर्जी में eosinophil का काउंट बढ़ना ही बढ़ना है. Next you will see there is a more increase in plasma cells. Plasma cells, pathologic integration, plasma cells, they are chronic inflammation. So in this inflammatory disease, these plasma cells are getting more in number. You will see also increase lymphocyte count as well as more histiocyte count. Getting the point? Now we are going to talk about this our conjunctival vessels proliferation. So there is our conjunctival vessels proliferation. What are the important points you have to remember for this conjunctival vessels proliferation? See here, you will see due to the inflammation, there is the conjunctival vessels permeability is increased, and when it is getting increased, that will lead to the vasodilatation, and due to the vasodilatation, there is a more and more fluid discharge will be there. Okay, sir. Epithelial hyperplasia, simply you have to remember there is the proliferation of the epithelium. Now see here, fibrous layer proliferation. Due to this fibrous layer proliferation, you will observe there is our hyaline changes are visible. So you will see there is a hyaline changes, and due to this all kind of the different pathological changes. Yes, now we are making the summary. इनके कारण वर्नल केराटोकंजक्टिवाइटिस में क्या फर्क पड़ेगा? See here, due to this all pathological points, yes, you will observe, yes, this all are lead to multiple papilla in upper tarsal कंजक्टाइवा. दिस इज वेरी इंपॉर्टेंट पॉइंट. अब इस पेशेंट के ऊपर वाले कंजक्टाइवा को हम देखते हैं. सी हियर, फॉलो अवर, यस, खुराना सर टेक्स्ट बुक. You will see there is the allergic conjunctivitis. Okay, sir. We had seen the seasonal allergic conjunctivitis earlier. We had seen the perennial conjunctivitis. Now, right now, we are looking the vernal keratoconjunctivitis. Here you are observing. This is the eye. You can follow this figure from the Khurana sir textbook. There is a multiple papilla projections in the upper tarsal plate. Yes, ये eye है. आपने eyelid को turn किया, and in upper tarsal plate you are looking the various small elevations. So this is the point. जैसे ये पेशेंट आपको दिखे तो आप सोच सकते हैं, yes, it is the case of the our vernal keratoconjunctivitis. Getting the point? So for your clinical preparation, using this image, okay, so yes, so this is the multiple papillum formation. Okay, follow this image. You can judge the multiple papilla formation. आराम से धीरे धीरे, कोई हड़बड़ी नहीं है. फॉर्मेशन एट अपर conjunctival plate. So this is one very important characteristic feature. Now try to understand. We are going to look the clinical features. Okay, sir. These are our different points, but right now we are going to look what are the different our clinical features. So we are going to focus for the clinical features. Okay, so try to understand. First we are going to talk about the symptoms. Do you remember symptoms and sign? So अंडर द टू कैटेगरी, एक वो जो चीजें जो पेशेंट बताएगा, एक वो जो चीजें जो आप देखेंगे. सो फर्स्ट वी आर गोइंग टू टॉक अबाउट द symptoms. Another things which we are going to talk, that is the signs. So observe here. First the symptoms. These patient will present with Yes, itis is there. Conjunctivitis, it is the keratoconjunctivitis. Yes, itis. So, red, hyperemic, congested, edematous, swollen. Pathology integration. Also, you will see rubor, tumor, dolor, calor, functionally, sir. So, this is our hit point, which is beautiful integration with our pathology. So, just one summary. Yes, you have to go, you have to recall our pathology classes. This is our patho-conceptual brainstorming integration. Fine. Now, try to understand. You will see what are the different points according to it. Yes, बहुत ज़्यादा लाल दिखेगा, हाइपरेमिक होगा, कंजेशन आपको दिखेगा, स्वेलिंग आपको नजर आएगी, पेन हो सकता है, फोटोफोबिया हो सकता है, ओके, प्रॉपर विजन विल नॉट बी देयर, बट स्पेशली द पेशेंट दे आर सेइंग अबाउट burning sensation. Okay sir, it is allergic situation, that's why patient will complain, sir आंखों में जलन का एहसास होता है. Yes, you will see there is itching sensation, and these are more in warm humid कंडीशन. जब जब टेम्परेचर बढ़ेगा, गर्मी का सीजन आएगा, या गर्मी के दिन में कभी और ज्यादा गर्मी बढ़ गई, ओके, तब तब पेशेंट बोलेगा डॉक्टर साहब आंखों में खुजली और जलन का एहसास बढ़ जाता है. आप जब उसकी आंखों को देखते हैं तो अपर कंजक्टिवल प्लेट में ऐसे बड़े बड़े दाने नजर आते हैं. दिस इज द केस ऑफ द वर्नल केराटोकंजक्टिवाइटिस. रिमेंबर द पेशेंट एज ग्रुप इज यंग बॉय कॉमनली. Okay, now try to understand the other points. You will see there is the problem with the light also. So photophobia, सारे एलर्जिक कंजक्टिवाइटिस में यही तो मिल रहा है. ऑल्सो यू विल सी देर इज अ मोर एंड मोर इन्फ्लामेशन, तो इसलिए उसकी आंखों से खूब आंसू बहेंगे, लैक्राइमेशन विल बी देयर. एंड वन वेरी वेरी इंपॉर्टेंट फाइंडिंग, दैट इज आवर स्ट्रिंगी ropey discharge. So there is the stringy ropey discharge. Yes, from the eye there is the secretion, stringy ropey discharge. See here, this is also known as the Maxwell Leon sign. Okay, so there is the stringy ropey discharge. So you can see such kind of situation. Can you see? Yes, there is the inflammation, and that inflammation is leading to the severe kind of the discharge. When you're pulling that discharge, it is making one thread like structure. So this is your situation, aiding that image here. So you can observe this point. This is stringy ropey discharge. क्लियर बेटा, बहुत ही प्यारा सा डायग्राम है, आप भूलेंगे नहीं. सेम काइंड ऑफ द situation you will see in the clinic. Fine, so remember this point. This is seen in case of the vernal keratoconjunctivitis. Now what are the other things you can remember? Due to the inflammation, there is the heaviness of lids also. So these are the different complaint which are told by the patient. Patient बताएगा डॉक्टर साहब खुजली होती है, जलन का एहसास होता है, लाइट में आंखें चौंधिया जाती हैं, आंसू बहुत आता है, आंखों से तार जैसे हमारे सिक्रीशन निकल रहे हैं. जब भी वो आंखों को बंद करेगा तो तार 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 जैसा आपको नजर आएगा. वो अगर आंख को साफ करता है तो ऐसा तार जैसा निकलेगा. यस, स्ट्रिंग लाइक डिस्चार्ज विल बी देयर. आंखें जो है, आईलिड जो है, पलकें जो हैं भारी लगती हैं. सो दीज आर द different situation. Now we are going to look for the our different signs. So we are looking for this signs. I am making the diagram here. Okay, so we are looking for the different signs. So try to understand when you will focus in your textbook, then you will observe one diagrammatic presentation. It is one very easy diagram which you can draw in exam for the university, which you can use for the next NEET, FMG, USMLE plab, different points. You will see in the our eye at the upper eyelid दाने दाने टाइल्स के जैसे, जैसे टाइल्स में दाने होते हैं वैसा आपको दिखेगा कोबल स्टोन पैपिला. These are having the hexagonal shape. Yes, you will see gelatinous limbus membrane. यहाँ पर limbal area. What is the limbus? I already told you, the junction between our conjunctiva and our cornea. तो यहाँ पर आपको gelatinous membrane नजर आएंगे and there is the granule formation जिसको हम horner tranta spot कहेंगे and on each corner you will see dusky red triangular congestion. तो एक बार इस डायग्राम को हम क्विकली बनाने की प्रैक्टिस करते हैं. You can draw easily. Yes. Suppose this is our eye. Okay, sir. This area is showing the our medial canthus. Fine, sir. Now you will see the small our punctum also. Okay, sir. What is happening? You are looking in the upper palpebral conjunctiva. We are showing, yes, these are the our eyelids with the hairs. Okay, sir. So this is our eyelid margin. Diagrammatic presentation you can also do. Diagram से आपको ज़्यादा marks मिलते हैं. Okay, so we are going to look. You can retain in the brain for the longer time. Okay, sir. Now you are observing there is the our upper tarsal conjunctiva. You are turning and you are looking inside the palpebral conjunctiva. Here you will see especially the papilla and which are especially the hexagonal in shape. Yes, these are hexagonal in shape, characteristically hexagonal. Okay, so I am not drawing exactly the hexagonal, yes, but you will see it is loaded with the various, yes, these are actually the polygonal hexagonal in shape. These are the papilla. So can you draw it? Definitely, sir. It is very easy. It is not difficult. And diagram will give the more and more marks in your university exams. Getting the point? Okay, sir. We can do it. Now try to understand. You will draw here the our, yes. Suppose this is the our cornea. Pigmented iris area. And you will show the pupil as the black color. The patient is looking downward. Okay, sir, this is the pupil. Getting the point? This entire portion. Yes, this is our pigmented iris. So carefully you can show this image, you can draw this image. Okay, sir. Now try to understand. There is the formation of gelatinous area. So that is gelatinous limbal membrane. So this is the gelatinous limbal membrane is formed. Okay, sir. And here you will observe there is the formation of spots, showing that spots these are our Trantas spots. Just one diagrammatic simple presentation. Fine. And what you can show other things, try to understand better. Yes, you will observe there is the dilatation of the vessels. Fine. Yes, there is the dilatation of the vessels, congestion of the vessels on its side. फिर से आराम से. Yes, what are the different findings in this disease? Yeah, we are reading slowly, but this all will impact in our brain for the long term memory. एक एक पॉइंट को करते हैं और ये थ्योरी एग्जाम्स में हमको बहुत अच्छे से सॉलिडिफाई करेंगे. See here what are the different findings. You can follow the Khurana sir textbook. First point better. Yes, दाने दाने जैसा नजर आ रहा है, सो यू विल से द कोबल स्टोन, देर इज द अवर कोबल स्टोन पैपिला। डू यू रिमेंबर? ऐसा ही कोबल स्टोन अपीयरेंस हमने कहां देखा था? यस, इन आवर पैथोलॉजी, inflammatory bowel disease, there was the Crohn's disease, and there was the your, yes, I'm making the chat box open. You can comment in the chat box beta. Okay, yes, you're very welcome. Yes, so here Charvi is here, Suraj is here. Charvi is from the FMC Pune, that is a very nice thing. And Suraj is also always connected with our channel. Thank you for your response beta. Okay, so chat box is open. I'm making unmute also. Okay, you can talk directly with me also. Okay, just make clear your background noise, पीछे से बस बेटा कोई आवाज ना है. एंड यस, पार्टिसिपेट एक्टिवली. तो आपको याद है कौन सी डिसीज में था बेटा? यस, ये
inflammatory bowel disease.
inflammatory bowel disease. Do you remember two types of the inflammatory bowel disease? Very good beta. One was the Crohn's disease and another was the ulcerative colitis. Can you recall Koval stone appearance?
Yes sir. CSF was the mnemonic.
वेरी करेक्ट, वेरी करेक्ट, बहुत बढ़िया बेटा. सी फॉर कोबल स्टोन अपीयरेंस, एस फॉर स्ट्रक्चर स्ट्रिंग साइन ऑफ द कंटूर, एफ फॉर फिशर. ओके, एफ फॉर फिस्टुला. दिस ऑल द सीएसएफ फाइंडिंग वाज फॉर द आवर क्रोन्स डिसीज. सो जस्ट टू रिकॉल, ये बहुत इंपॉर्टेंट पॉइंट है. दिस विल बी अगेन रिपीटेड इन योर मेडिसिन एज वेल एज सर्जरी. फाइन. अगेन come to the our next part beta. These are actually hexagonal appearance. So what you will mention, there is the hexagonal papilla formation, MCQ. Now you will see there is a gelatinous limbal membrane. Yes sir, there is the formation of the this third point. This is our gelatinous limbal membrane. So you have to draw only diagram. आप ड्रॉ करते हैं आपको बहुत अच्छे मार्क्स मिलेंगे. एंड देयर इज द अवर स्पॉट्स. these mass are known as Horner Trantas spot. MCQ. यही सारी चीजें आपके आने वाले नेक्स्ट INICT, एम्स, PGI जो भी बोलते हैं बेटा, तो थ्योरी से ही सारी चीजें उठती है. अगर आपका थ्योरी स्ट्रांग है, कॉन्सेप्ट स्ट्रांग है, हर चीज आप ब्रेक करेंगे. नाउ कम टू दिस आवर dilated vessels. This is given as the dusky red, yes, triangular congestion. The reference is from the Khurana sir textbook. So these are the findings which you have to draw, which you have to remember. Now after this all, we are going to discuss more points in detail. Yes, we are going to talk about our different signs. Okay sir, so how we can present in our theory exam? You will make one flow chart and there are the three forms. What are the three forms of the signs? Signs जो डॉक्टर देखता है वो साइन है, जो पेशेंट बताता है वो सिम्टम है. We had completed the symptom. Now we are looking the sign. How the vernal keratoconjunctivitis patient will come. Again, one quick revision बेटा. One patient is coming. एक लड़का आता है गर्मी के सीजन में, उसकी आंखों में कुछ इस तरीके के मैनिफेस्टेशन है. गर्मी के सीजन में, इट इज नॉट फाउंड इन द कोल्ड सिचुएशंस. कोल्ड कंट्रीज वहां नहीं मिलेगा. ओके, नाउ सी हियर, it was seen that it is seen in the spring season, but it is actually the misnomer. तो ये स्प्रिंग कटार, कटार मीन्स एक्सेसिव सिक्रेशन. स्प्रिंग समय में बहुत ज्यादा सिक्रेशन होता है, इसलिए स्प्रिंग कटार. बट लेटर इट वाज सीन दैट it is not found in the spring season, particularly it is found more in warm season. That's why new name of this disease is warm weather catarrh. Now I told you the patient is coming with the RBI. क्या बोल रहा है बेटा पेशेंट? रिकरेंट इन्फेक्शन है, इन्फ्लेमेशन है, दोनों आंखों में है और इंटरस्टिशियम डीपली इन्वॉल्वमेंट हुआ है. देयर इज अ एलर्जी जो कि हमने अपने पुराने वीडियो में डिस्कस किया है. सेल्फ लिमिटिंग है, इट ऑकर्स इन द स्प्रिंग सीजन. नाउ सी हियर दैट all the scenario 4 to 20 years male is coming, more commonly seen in the summer due to the pollen allergen. Okay, so it is related with the our hypersensitivity reaction, microbiology integration. But new theory says that Th2 lymphocyte alteration is there. And pathology हमने याद किया A B C D E F, जिसमें B नहीं है, D नहीं है. Yes, ACE. You know ACE, angiotensin converting enzyme. Yes, you can remember. You can remember our biochemistry, that is the ACE are our antioxidant vitamin. So these are our points. And when you are turning the upper eyelid, तो उस बच्चे के upper eyelid को आपने turn किया, याद है हम आंखों को ऐसा पलटा करके देखते थे. In the similar way, you are looking the upper eyelid in this way. So you are looking the multiple papilla, hexagonal in shape, and when you are observing inside, then stringy ropey discharge is there, that is known as the Maxwell Lorentz sign, stringy ropey discharge. And then you are observing the different signs which I already told you. अब इन्हीं चीजों को हम थ्योरी एग्जाम में कैसे प्रेजेंट करेंगे. See here, the first point you will see in the palpebra, that's why you will say the palpebral form first. Also you will see the changes in the eye region, so you will say bulbar form. Palpebra means eyelid, bulbar means our eye bulb. Okay, and third is our mixed form, which will present with both kind of the symptoms, both kinds of the presentation. Now palpebral form, what the different points you had seen? First, yes, we had seen the cobblestone, also you can say pavement stone appearance. Okay sir, pavement stone appearance you will see. Yes, it is seen in upper tarsal conjunctiva, not in lower. So this is the one another important finding. And remember, it is bilateral, दोनों आंखों में नजर आएगा. Okay, also you will see there is the excessive hypertrophy. This cobblestone appearance is itself saying that there is the hypertrophy of the upper tarsal conjunctiva. Okay, now this hypertrophy will produce, yes, it produces cauliflower like growth. yes, इनके प्रोजेक्शन बनेंगे. ये जो प्रोजेक्शन है ऐसे लगेंगे जैसे आईलिड में फूल गोभी उग गए हैं. जस्ट वन फनी पॉइंट. ओके, यस, वी आर ड्रॉइंग जस्ट स्मॉल cauliflower here. Okay, so these are hexagonal papilla which are appearing like the cauliflower like growth. Yes, you can see. ऐसा इमेजिन करो कि यहां पर फूल गोभी उगे हैं. Okay, so these are having the appearance like the cauliflower. Now try to understand, these are known as, yes, next point, these are known as giant papilla. These are known as giant papilla. Now further, also there is our ropey stringy discharge. So these are our different signs regarding the palpebral form. Okay, more involvement of the our palpebral region. So just adjusting this all for your e-notes. Yes, stay connected with our all the social media channel. At the Telegram you will get this e-notes. Every social media channel, either the Insta or the YouTube or our Facebook, Dr. Shrikant Verma classes, you will get there. Okay, now bulbar form, we are going to talk about the bulbar form. So for this bulbar form you can remember one mnemonic. इसमें हम कुछ चीजें देखने जा रहे हैं. Mnemonic क्या है? That is our one funny way, that is GH का डोंकी. ओके, गर्ल्स हॉस्टल का गधा, गर्ल्स हॉस्टल में एक गधा है. ओके, सो दिस वन फनी निमोनिक विल रिकॉल व्हाट आर द bulbar form. So what you can remember? G for there is the gelatinous, yes, thickened accumulation of tissue around limbus area. Okay sir, so this is the first point G. Second point you have to remember, yes, ये पहले ही मैं आपको दिखा चुका हूं, gelatinous tissue accumulation at the limbal area. What is the limbus? The junction between the cornea and the our sclera. तो यहाँ पर जेलेटिन लाइक मटेरियल का डिपोजिशन आपको देखने के लिए मिलेगा. यू विल सी द अनदर पॉइंट H. व्हाट इज द H? दैट इज अवर हॉर्नर्स. ये बार बार हॉर्नर वर्ड आता है. इन आवर एनाटॉमी देयर वाज द हॉर्नर सिंड्रोम. ओके, whenever there is a lesion to the T1, yes, whenever there is a CA-T1 lesion, Klumpke's paralysis, then you will see the Horner syndrome. But this is the Horner's Trantas spot. यानी कि जो हॉर्नर था उसने काफी सारी चीजें ऑप्थेल्मोलॉजी में स्टडी की. ओके, नाउ दिस हॉर्नर ट्रांस स्पॉट, व्हाट इज दिस? दिस इज अवर white raised dots along limbus. yes, यहां पर हमने ड्रॉ किया व्हाइट कलर की स्पॉट, व्हाइट रेस्ड एलिवेटेड डॉट्स. yes, we are going to follow this all the things in our Khurana sir textbook also, but last point we are going to look, that is the donkey. what is this donkey? D for you have to remember, there is the dusky red triangular congestion. Okay, so these are our different points. We are going to look the image, but before that I am just adjusting this one for your e notes. yes sir, so these are the our different points. okay, so you can remember these points for the bulbar form, and mixed form definitely you can recall it will have both the features. It will have, yes, both forms together. okay, I am writing this one also exactly down to it. both forms together, combination, simply. now refer your textbook better. You can see here these images, follow at your textbook. Can you see this beautiful diagram? yes, so follow your textbook. you can observe these beautiful images, never you will forget. okay, for your convenience adding this image exactly down to this. okay, so one analysis again for these images. now try to find out, एक बार सोचो बेटा, खोजो क्या क्या चीजें दिख रही है आपको यहां पर. just try for it. yes sir, can you see? this is our gelatinous thick membrane. yes sir, कभी नहीं भूलोगे आप. कहां पर? around limbal area. okay, so this is the point. can you see there is, yes, triangular dusky red congestion. yes sir, it is approximately triangular. follow it. okay, and can you tell me what should be the name of this whitish spot? yes, these are our Horner's Trantas spot. Clear everyone? So never forget these points. Okay. Now we are going to look for the more points. After this all, we are going to look for the our one more finding. You can follow your textbook. You will see there is our vernal keratopathy. Keratopathy means beta corneal involvement. So we are going to talk about the our, yes, corneal involvement. This is the conjunctivitis. Okay, sir, vernal conjunctivitis. But there is the involvement of the cornea also. That's why better to say vernal keratoconjunctivitis. So right now we are going to look for the our vernal keratopathy. Okay, sir. So we are going to talk about the our vernal keratopathic corneal involvement. So you will see in this disease there is the corneal involvement. That's why we are using the term keratopathy. Yes, kerato means cornea. Now try to understand. You will see there are the two types of the our keratopathy. Yes, sir. What are this? You will observe it may be the primary, it may be the secondary. Primary means directly cornea का involvement रहेगा. Secondary later, yes, first there will be the conjunctival involvement, then cornea will involve, and this all will be due to extension of लिम्बल लीजन. यस, लिम्बस में जो इन्फ्लामेशन हुआ है वो फिर कॉर्निया में धीरे से आ रहा है. नाउ नेक्स्ट पॉइंट विच यू कैन रिमेंबर मोस्ट कॉमनली सीन इन पाल्पेब्रल फॉर्म. बल्बर फॉर्म में ये नहीं दिखाई देता, पाल्पेब्रल फॉर्म में ज्यादा नजर आता है. एंड यू विल सी देयर आर द डिफरेंट 5 टाइप्स ऑफ lesion. Okay, sir. What are the different 5 types of the lesion? First, you will see there is punctate epithelial keratitis. Okay, sir. There is the punctate. दाने 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 दिखाई देंगे. कहां पर? कॉर्निया में इन्फ्लामेशन होगा, इपिथीलियम का इन्वॉल्वमेंट रहेगा, विच इज involving especially the upper cornea. Getting the point? Clear? Now try to understand the next point. There is our ulcerative vernal keratopathy. You will see there is the formation of the ulcer which are known as shield ulcer. So this is the another point. एक तो दाने दाने नजर आएंगे. Okay, sir, that's why vernal epithelial keratitis. Another thing, you will see there is the our shield ulcer. Yes, shield ulcer. You can remember the our shield from the Avenger movie. Okay, so just one funny way. Yes, this team is our shield team. Okay, in comic character you can see. Just to remember, adding this image, so you have to remember the shield ulcer. Yes, so what you can focus, see here, you have to see the shield ulcer. What is a shield ulcer? Suppose this is the our cornea. Okay, sir. Then in the upper part you will see there is the one ulcer is formed. Yes, you will see the shallow transverse ulcer where in upper part of what? Cornea. So at the upper part of the cornea you will see the shallow transverse ulcer. Fine. Now try to understand why it is occurring. Yes, it occurs due to epithelial मैक्रो इरोजन्स. तो इपिथीलियम को पूरा उखाड़ दिया गया है. ओके, एंड यू विल सी लेटर इट इज कॉम्प्लिकेटेड बाय बैक्टीरियल केरेटाइटिस. क्योंकि यहां पर अल्सर हो गया है तो बैक्टीरियल इन्फ्लेमेशन इसको इन्वॉल्व करता है. सो देयर इज द आवर बैक्टीरियल केरेटाइटिस. नाउ you will see the image from your textbook. Follow this beta. साथ में बुक को ओपन रखो. Can you see this image? Yes. Can you see one more? You can see A is the shield ulcer and B point is showing. Yes, shield ulcer and Vernal corneal plaque. Can you see? Mainly in the upper part it occurs. यहाँ पर एक बड़ा सा अल्सर बन गया. This is the shield ulcer. Okay, but generally it is seen in the upper part and it is running transversely. Getting the point? And later it is making the plaque. जैसे कि हमने atherosclerosis में पढ़ा था, there is the our erosion of the endothelium and then there is the endothelial ulcer within the blood vessel and later it makes the fibrofatty plaque. तो उसी atherosclerosis के साथ कंपैरिजन करते हुए चलिए, this is our corneal involvement. Getting the point? Yes, it is our corneal involvement. So you can follow this corneal involvement. Yes. So these are the images. Fine. You can see this is our shield ulcer and next you can follow in the image that is our vernal corneal plaque. Getting the point? Yes. What are the other points? You can remember दो चीजें आपने देखी. तीसरी चीज, yes, now we are including the third our corneal involvement point, that is सेम कॉर्नियल प्लैक. इमेज अभी हमने देखा. यस. तो बेटा एक बार पढ़ो, तगड़े से पढ़ो और अपने नोट्स का फिर रिवीजन बार बार करो. यस, कॉर्नियल प्लैक, व्हाट यू टू रिमेंबर, इट इज ड्यू टू कोटिंग बाय एक्सुडेट्स. एक्सुडेट्स निकल रहे हैं and whatever the healthy areas in between, ulcerative areas in between, there the exudation is getting deposition. ये exudate कुछ और नहीं है. yes, proteins हैं, they are getting the formation, they are getting the deposition, deposited form. वो जम जा रहे हैं और एक plaque का formation कर रहे हैं. also you will see there is the sub epithelial scarring. बाद में वही अल्सर जो है वो फाइब्रस हो जाएगा. पैथोलॉजी, टोटली पैथोलॉजी चल रही है एक तरीके से. फाइन. सो देयर इज अवर फाइब्रोसिस. व्हाई इट ऑकर्स? रिमेंबर, जनरली इन फॉर्म ऑफ रिंग scar you will see. Next you will see there is our pseudo gerontoxin. So there is our pseudo gerontoxin formation. Getting the point? Yes. What is this pseudo gerontoxin? It is due to recurrent limbal disease. बार बार लिम्बस का इन्वॉल्वमेंट होने के कारण होता है. So this is our due to recurrent limbal involvement. Pseudo gerontoxin is formed. Next, what is this? ये एक्चुअली है क्या? Yes, it is characterized by Cupid's bow outline. So this is one another MCQ. Yes, see here, image से आपके concept clear होते हैं. See here, we are looking for our Cupid bow outline in VKC. आपके खुराना सर की टेक्स्ट बुक में ये इमेज नहीं दिया हुआ है, but you can focus this image from the internet sources. So Cupid bow outline. See here, ये Cupid outline क्या होता है? Can you see this arch like? Okay, so this is the Cupid arch bow. Okay, Cupid bow. ऐसा जो शेप दिखता है इसको हम कहते हैं yes Cupid. Now you can see the similar kind of the appearance here. Yes sir, this is presenting the Cupid bow outline. So hope now you are having the clear concept with this arrow. Okay, now try to understand the further things. We are going to talk about the clinical course. Just one point, it is very big topic. Treatment portion we will do in our next session, but few line, ये जो डिसीज है वो ऑटोमेटिक ठीक हो जाती है. दिस इज द सेल्फ लिमिटिंग डिसीज. तो सर प्रॉब्लम क्या है, हम डॉक्टर के पास क्यों जाएं? यस, सी हियर, इट इज क्योर्ड इन 5 to 10 years. इसको ठीक होने में लेकिन 5 से 10 साल का टाइम लग सकता है. सो द पेशेंट इज वेरी हैविंग प्रॉब्लम्स ड्यूरिंग दिस 5 to 10 years, इसलिए डॉक्टर के पास जाना पड़ेगा. यस, एंड डिफरेंशियल डायग्नोसिस, ये डिसीज जो है वो कंफ्यूज करेगी किसके साथ? यस, इट विल कंफ्यूज विद द ट्रैकोमा. हमने ट्रैकोमा देखा था, ट्रैकोमा विथ प्री डोमिनेंट पेपिला फॉर्म. ओके, papillary hypertrophy. Getting the point? So these are the different things. तो ट्रैकोमा के साथ अपने को इसका डिफरेंशिएशन करना है. Okay, so these are the our different points regarding the vernal keratoconjunctivitis. Yes, treatment अलग से हम इसके बारे में डिस्कस करेंगे पूरे एक क्लास में. That will be also very important. Remember, this vernal keratoconjunctivitis is very important disease. So what we are looking, yes, image based study. एक लड़का आता है, उसको समर सीजन में इन्फ्लामेशन है, उसकी आंखों में इस तरीके के स्पेशल अपीयरेंस आपको नजर आ रहे हैं. यस, वो बोलता है कि गर्मी के समय में, स्प्रिंग सीजन में स्पेशली होता है, स्प्रिंग सीजन में, बट इट इज एक्चुअली द मिसनॉमर. गर्मी के सीजन में ये ज्यादा आपको देखने के लिए मिलेगा. स्पेशली इट इज रिकरेंट बायलेटरल एंड इंटरस्टिशियल. हमने आरबीआई का निमोनिक बनाया. एंड देन वी आर लुकिंग इन आवर कंजक्टिवा, देयर इज द पेपिला फॉर्म, cauliflower like growth. Yes, you are looking the Maxwell-Lorentz sign. You are looking these our different points: dusky red triangular congestion, Trantas spot, gelatinous limbal, hexagonal papilla, cobblestone papilla. Okay, you are observing, yes, that gelatinous mass, same triangular dusky area. Yes, you are observing the horner Trantas spot. Image based study, ऐसे ही आपके नीट में क्वेश्चन आते हैं. You are getting the shield ulcer. हमने एक निमोनिक शील्ड का बनाया. You are getting the shield ulcer, transverse ulcer over the cornea. You are getting the plaque formation. Yes, so these are our the form presentation of the vernal keratoconjunctivitis. So treatment portion we will do in next class. Thank you very much. God bless you all. Now we are starting our live doubt discussion session. Thank you.